A physician associate is a medically trained healthcare professional, and we train our students to work to the medical model, and classically this involves training a physician associate so that they are able to conduct consultations with patients, which include being able to take a full history from a patient, being able to physically examine where appropriate, order and interpret test investigations in order to come to a list of differential diagnoses or diagnosis, an appropriate management plan, and follow up thereafterwards. Students come from a variety of backgrounds, which does make the learning environment incredibly rich and really does make my job as course leader and part of the teaching team so rewarding. We have students, graduates from the University of Central Lancashire here, who perhaps have studied psychology, biomedical science, BMed science, operating department practice. We also have students coming in from other universities or other backgrounds who want to make that shift, a career change, have the capacity to do this, and they come in and are able to make that transition into a clinical environment and job thereafter.
What I like about the course the most is the content. In the boot camp, which is the intense science of things, the theory side of things, it's very informative. They use a variety of lecturers of different backgrounds, both internal and external. And the teaching becomes much better because you're being taught from different expertise with different sort of vast amount of knowledge. So for me, that's very important.
I can't pick one thing in particular that I love most about the course. If I had to, I'd say the clinical skills labs at this uni. They're amazing. All the different cubicles they have really simulate how it would be in a hospital. So there's plenty enough room for like 2-3 students in one room, and then they have the beds and then all these different mannequins that we can use, which we can use for all the different examinations. Like they have the normal mannequins, they have like life support ones, you'll have like ones for breast examinations, you'll have ones for like taking blood, they literally have everything.
The university have also given us pseudo patients, so we have these fake patients that come in every single week, which gives that really realistic atmosphere in which we can practice on them, and they actually do have some comorbidities, so we can actually pick up on things and bring that into our real life practice when we do become physician associates.
So the employability prospects for our students look very favourable. We have all our graduates in employment, those who have chosen to continue with their career as a physician associate, and the vast majority of our students have remained in the Northwest, therefore helping to fulfil the workforce demands and needs of our NHS here in the Northwest and our general practices too.